This is ADL4, Eating and Drinking, or Nutrition and Hydration. This begins on page 12 of the nursing document. In Portiuncula, we changed the wording of names for food and drinks in 2019. We used the IDDSI framework for describing food textures and drink thickness to improve safety for individuals with swallowing difficulties. So here is the old terminology that we used. We used to use grade 1, grade 2, grade 3, and now this is the new terminology which we use. So level 0 is thin, level 1 is slightly thick, level 2 is mildly thick, level 3 is moderately thick, level 4 is extremely thick. And then that's in relation to drinks and fluids. And then when we're talking about food and solids, level 7 is regular, level 6 is soft bite-sized, level 5 is minced moist, level 4 is pureed, and level 3 is liquidized. So on to our assessment. This is on page 13. So the first part of this assessment, it tells you here, malnutrition screening tool MST is to be completed on admission and then weekly on all patients. See page 14. So I'm just going to skip down to the next page on page 14 to show you the MST. This is the malnutrition screening tool. This needs to be completed on admission and weekly. So we have 2 questions that we ask our patients. We identify the patient's weight score. So question 1, weigh the patient and ask, have you lost weight recently without trying? So if the patient says yes, identify how much weight has the patient lost. If they've lost between 1 and 5 kgs, we score them a 1. If they've lost between 6 and 10 kgs, we score them a 2. If they've lost between 11 and 15 kgs, we score them a 3. And if they've lost greater than 15 kgs, we score them a 4. If the patient says that they haven't lost weight, we score them a 0. If the patient is unsure, try to clarify with them. Ask them, do they suspect that they have lost weight? Perhaps their clothes is looser. So if there is possible weight loss, you score the patient a 2. The next thing is question 2, the appetite score. So you ask the patient, have you been eating poorly because of a decreased appetite? So if they answer yes, you give them a score of 1. If you answer no, a score of 0. So a decreased appetite, for example, is less than 3/4 of usual intake, or eating poorly due to swallowing or chewing problems. So you document your scores in the table here. You put in the date of the assessment here, the patient's weight, the answer to question 1, their weight score, the answer to question 2, their appetite score. So you add these up and this gives you your MST score. So you put your score in there and you put your signature here. So if you go back up here, it tells you their MST score. If it is 2 or greater than 2, give Complan twice a day while awaiting the dietetic review. Okay, so Complan does not need to be prescribed. Commence food record chart. Refer patient to dietitian and activate Care Plan 4A and MST risk interventions. And just at the bottom of the MST chart then, note small weekly weight losses add up to a significant weight loss and malnutrition. 1 in 4 patients admitted to Irish hospitals are malnourished or at risk of malnutrition, and that comes from Bappen 2011. So sometimes it is difficult to get a height on a patient if they are unable to stand. So we can estimate the patient's height by getting an ulna measurement. So this is how to estimate height from ulna length, a surrogate measure for height. So measure between the point of the elbow and the midpoint of the prominent bone of the wrist, the left side if possible, and you have a diagram there. Okay, so you measure that and then you go down to your table, and depending if your patient is male or female, and depending on their age, if they're over 65 or less than 65, okay? So you go to their ulnar length, okay? So depending on their ulnar length, you can estimate what height the patient is, okay? So we can use that as a substitute for patients who cannot stand to get a measurement on the stadometer, okay? So back up to page 13 and we go to our assessment again, okay? So if after doing our MST assessment that we have identified that the patient is at risk, we need to go to our care plan, okay? We need to activate 4A at nutritional risk due to elevated MST score, we could document there. And then there's an intervention here, MST at risk interventions. So we need to activate this, okay? So again, it goes through what we need to be doing for the patient who has an elevated MST score. Commence food record chart, give Complan BD while awaiting dietetic review, assist with eating and drinking as needed. If nutritional intake is suboptimal, consider contributory factors, for example, nausea, vomiting, dietary preferences, constipation, poorly fitting dentures, mouth infections, etc. Review with medical team or catering as required and liaise with dietitian and implement recommendations. Okay, so we'll go back to our assessment. Baseline measurements. So the gold standard is that an actual height and weight are carried out on admission. If self-report option is used, indicate reason. Okay, so ideally we should be actually weighing and measuring our patient. Okay, so what is the patient's usual weight? The patient may be able to tell you that, or you may see it documented in the patient's in previous notes belonging to the patients. And then what is the patient's weight on admission? And it needs to be repeated weekly. So how did you obtain that weight? Was it a stand-on or seated weighing scales? Was it on the hoist? Was it a self-report? And if it was a self-reported weight, specify the reason why you needed to take a self-reported weight. Okay. The height then. So what is the patient's height and how did you obtain that measurement? Did you use an actual stadometer? Was it the ulnar length? Or was it a self-report? And again, if it is a self-report, you need to specify the reason why you could not measure the patient. So then we go into BMI, okay? So we document the patient's BMI here. So if you don't know how to calculate the BMI, we have a table then down on the next page. So I'll just scroll down here. So just after the MST, we have the BMI score, okay? So you have the patient's height in feet and inches, and then their weight in kg on the left, their weight in stones and pounds on the right, and their height in meters at the bottom, okay? So you get their height and you measure it up with their weight, and then you can see whichever section the patient falls into. So either they'll score a 0, they're in the white section, which means they are obese. If they're in the green section, then they're a healthy weight, but they score a 0. If they're in the yellow section, they score a 1. And if they're in the red section, they score a 2. Okay? So you can get your BMI score there, and then we go back up to our assessment. And as you can see there, it tells you if the BMI is less than 18.5, the patient is underweight. If the patient's BMI is between 18.5 and 24.9, the patient is within the healthy weight range. If the patient's BMI is between 25 and 29.9, the patient is overweight. And if the patient's BMI is 30 or more, then the patient is obese. So you tick whichever one applies, okay? So we'll go down to our assessment. Patient's appetite, is it usual, increased, decreased? So tick whichever one applies. Does the patient have any specific dietary requirements? So yes or no. Okay, so maybe the patient is diabetic, maybe they're celiac, maybe they're on a low sodium diet. Whatever it is, you can document it there. Does the patient require a modified diet? So tick yes or no, and if so, you indicate what level it is there, and that's your IDDSI guidelines, which we spoke about earlier. And again, does your patient require thickened fluids, yes or no? And if yes, the level of thickened fluids. Does the patient have any difficulty swallowing, yes or no? Swallow assessment required, yes or no? And then who was the swallow assessment completed by? Okay, so was it the speech and language therapist, was it a nurse or a doctor, and what was the result of that? Any dietary preferences that the patient may have? Is the patient on parental nutrition, tube feeding, nutritional supplements, and you can specify there. Does the patient require assistance, yes or no, and you can comment there. Has the patient any nausea or vomiting, yes or no, and you can put in your comment there. And does the patient drink alcohol, yes or no? How many drinks do you have over a week? The maximum standard drinks recommended is 17 for men and 11 for women. Okay, so now we've done our assessment, we'll go to our care plan. So we activate whichever is relevant here. So the patient is at nutritional risk due to, so you can document there whatever that reason is. Okay, so for B, fluid volume deficit due to, maybe the patient has been vomiting or has diarrhea, so they're dehydrated. And 4C, specific dietary requirements. Perhaps the patient is diabetic or celiac, or they're on a low sodium diet or a low fat diet, whatever it is. So the expected outcome, optimal nutritional status is maintained. So we go into our nursing interventions, and the first one here is yellow all the way across. So this is relevant for all patients. Record baseline height, weight and BMI. The next intervention, if BMI is greater than 30, inform medical team and provide healthy eating and lifestyle leaflet. Okay. MST at-risk intervention. So we've spoke about this already. This is what we would activate if the patient has a high MST score. Encourage oral intake, assist with feeding as required, observe for swallowing difficulties, liaise with the speech and language therapist. Where there is sensory loss to one side of the face, feed patient on the unaffected side. Check that food does not accumulate on the affected side. NPO sign placed above bed. Monitor blood glucose levels. Crush medications. Administer enteral or TPN feeding as per dietitian prescription and record. Attend to site care for NG or PEG. Confirm correct placement of nasogastric tube, so X-ray prior to use, pH and tube measurement, mark, check before each use. Elevate patient's head and shoulders approximately 30 degrees to reduce risk of aspiration during administration of feeding. Ensure PEG or NG are secured appropriately. Give nutritional supplements as recommended as per MST or prescribed. Administer IV fluids as prescribed and document intake and output. If there's an NG tube in for drainage, output monitored and recorded. An antiemetic administered as required, monitor and document effectiveness. So you activate whichever interventions are relevant for your patient, and again we have blank spaces here so you can document your own interventions for your individual patient there.